Hello, everyone, and thank you for joining us for the latest in our series, Emerge into Equity. Today's discussion is on domestic violence and homelessness. We have a great slate of panelists here today with Councilmember David Ryu and the Los Angeles Commission on the Status of Women. We're going to get started in just a few moments. Hi, everyone. Thank you for joining our latest forum in the Emerge into Equity series, Women in the Time of COVID-19. We're about to get started with our slate of amazing panelists today. Again, this forum is hosted by Councilmember David Ryu and the Los Angeles Commission on the Status of Women. We're just gonna let a few more attendees join us today, and then we will get started. All right, thank you everyone for joining today's forum of Emerge into Equity, Women in the Time of COVID-19. Today's topic is domestic violence and homelessness. As a reminder, this is the second of 3 forums. There will be our third and final forum on Monday, September 21st at the same time. Thank you for joining the Office of Councilmember David Ryu and the Los Angeles Commission on the Status of Women, as well as our amazing panelists. I will now pass it on to Adina Bleich, Deputy Chief of Staff for Councilmember David Ryu, to kick it off. Adina?
Thank you, everyone, for being here. Just wanted to remind everybody that this forum will run as a panel with Councilmember Ryu doing moderated questions with these wonderful women leaders we have on the call. And at the near the end, at around the 15-minute, 20-minute mark, we will be doing Q&A from the audience by using the Q&A function. So if you look down at the bottom of your screen, there is an icon that has 2 conversation bubbles, and that would be the best way for you to submit a question. So we look forward to having this very important conscious raising conversation with all of you today. And with that, I will hand it over to Councilmember Ryu to begin the forum. Thank you.
Thank you. Thank you everyone for joining today. My name is David Ryu. I am council member of Council District 4, and we're having a little computer troubles today, so I'm using a different computer. So I'm gonna try to look to my bottom left corner, which the camera is on. So I apologize if it looks like I'm looking away, because I'm used to looking at the top. But I do want to thank everybody for joining us today for this second webinar in our series. I want to give a tremendous thanks again to our partners, the Los Angeles Commission on the Status of Women, for co-hosting the series with me. And together with this panel of remarkable leaders, and we have remarkable leaders this panel, we are hosting a series of conversations about the unique impact that the COVID-19 pandemic has on women. And today we'll be discussing in particular domestic violence and homelessness. The COVID-19 pandemic has taken a big toll on everybody, especially women. And this isn't just about the unemployment rates and the COVID-19 infections. We're also seeing a big increase in hospital visits for domestic abuse cases and the injuries that are being reported are more severe than they ever were before. We also know that domestic violence and homelessness are closely intertwined. In fact, nearly half of homeless women reported that they have stayed in abusive relationships over the past 2 years because they had nowhere to go. Domestic violence and homelessness are serious issues, and they both impact men and women. But we do know that both these issues impact women differently. And we have taken those differences in account, and we are working to find solutions and a targeted service approach. So I think today's conversation is very crucial, and it brings attention to these issues. And to do this, we have a fantastic group of panelists here today, and I want to make sure we spend as much time as possible hearing from them. So I do want to let them introduce themselves, and I'm going to ask and start with the incredible Faye Washington of YWCA. She has an illustrious experience and background and past, but I'll let Faye speak for herself. So Faye, can you say hello?
I can, and thank you so much, Councilman, for this conversation. And thank you, big shout out to the Commission on the Status of Women. Just a little history. I was part of the Ledge Analyst Office for the City Council that wrote the motion that created the Commission on the Status of Women, just so we'll know how far back I go. But I'm here as the President and CEO of the YWCA of Greater Los Angeles. It is probably one of the oldest women organizations around in Greater LA area anyway. We've been around 125 years, and we're still going strong. In fact, today we're going stronger. And I'm pleased to say we're going stronger because our mission simply is the empowerment of women, the elimination of racism wherever it exists, and this is why I joined the Y, by any means necessary. And it is that last little bit on it that gives me the privilege to fight for the rights of women, to fight for the rights of our families, to fight for the rights of the homeless, to fight for the rights of equity in pay, equity in the workforce, to fight for the rights is the reason that I'm here. And I've been here, Councilman, not almost, 20 years. And that's a long time. But it has gone so fast, it feels like it's only been 2. And I'm pleased to be a part of this conversation because it gives the YWCA the opportunity to expand beyond ourselves, honestly look at what someone else is doing, but more importantly, invite others into our conversation and into the programs that we offer the constituency of the Greater Los Angeles area.
Thank you, Faye. And not to embarrass you, but it's not just the status of the Commission on the Status of Women, but I think you also were in the city of LA to create the Department of Senior Services, Department of Aging, right? And
Me, okay.
Yeah, and then there was another. What's the other department? Well, there were several. Yeah,
there were a lot. Yeah. I was there a long time.
Yeah,
I was also a junior in high school when I started.
Yeah, that's right. So thank you, Faye. Next, we're going to hear from Eve Sheedy. If you could introduce yourself and also tell us about the work that you do.
Good afternoon or good morning. It's a hard act to follow, Faye, but I'll do my best. Thank you for all of your amazing work, and thank you to the council member and to the Commission on the Status of Women. I do want to also give a double shout out to the commission. I've been in touch with a member of that commission since the beginning of COVID and have always received amazing support. Also amazing support from Councilmember Ryu. So my name's Eve Sheedy. I'm the Executive Director of the Los Angeles County Domestic Violence Council, which is housed in the county's Department of Public Health, which has been very active in the last few months, as you all know. So my job is sort of encompasses 2 things that are connected. One is we run the county's Domestic Violence Coalition, and that coalition includes survivors, government agencies, nonprofits, and anyone sort of connected to domestic violence or providing services for people impacted by domestic violence. And we meet monthly. We run a number of committees and work throughout the county to improve the lives of anyone impacted by DV, including survivors, people who may cause harm, children, and so forth. We also have a very small, and with COVID, slightly smaller office within the Department of Public Health that works within the county to really try to raise the profile of domestic violence. So we do training. We've trained the Human Resources Department. We work on policy within the county to make sure that this is on everyone's mind. And prior to this, I just want to say I did work in the city attorney's office for 13 years and doing domestic violence policy. And I do want to thank the council member because he's always been raising the issue of domestic violence without any prompting, even from the Domestic Violence Alliance or other agencies, and has been a phenomenal supporter of survivors throughout his tenure on council. Thank you.
Thank you, Eve, and for all the work that you do. It is very important, the Domestic Violence Council. And next we have the fantastic Kandee Lewis. Kandee, please introduce yourself, and you might want to also maybe introduce the whole coalition that you're kind of representing as well.
Absolutely. Thank you so very much, council member. It's a pleasure to be here. And thank you for the to the status of women. It's a pleasure. So I am the executive director of Positive Results Center. You may know us as Positive Results Corporation. We recently changed our name, but we are the same amazing organization. And our mission addresses trauma from a cultural and age perspective. We primarily work with youth and young adults addressing teen dating, violence, sexual assault, and bullying. And while we talk about domestic violence and homelessness, we also have to talk about sexual assault, which is very prominent about both men, women, and children. And I'm also the founder of the Black Women Leaders of Los Angeles. It's a coalition of 13 organizations that are run by Black women leaders. And our motto is Trust Black Women, because what we do is we work with Los Angeles County from birth to death, and we provide wraparound services to ensure that youth, young adults, families have the resources and tools that they need, not just in COVID, but in all the time. And as far as Positive Results Corporation Center is concerned, we work with youth and young adults and really focus on creating awareness about what violence and abuse looks like. We believe that violence and abuse begins in the womb, and we cannot wait until it has happened. We have to address it from the very beginning, as young as possible, so that we can prevent and end violence and abuse. We also work with parents, providers, and educators and help them to understand what trauma looks like, especially from a cultural perspective. Because you said earlier that violence affects women differently, but it also affects children and youth differently, and women of color differently. And so we are here to support and engage and have a very real talk conversation, because COVID has affected us in the worst kind of way. But let's be real. Domestic violence, sexual assault, and homelessness was already at pandemic levels before COVID hit.
Thank you, Kandee, for that. And also, finally, we have Elizabeth Eastlund. It's a pleasure to have you here. Do you want to go ahead and introduce yourself and your organization?
Sure, thank you so much. And you all are hard acts to follow. So it's an honor and a privilege to be on the screen with you all and to share our experience. I am the Executive Director of Rainbow Services, and as of Tuesday, the previous past chair of the LA City Domestic Violence Alliance, which is wonderful. I'd like to also thank the Commission on the Status of Women for co-leading this experience. And also Councilmember Ryu, just a shout out to you. Like Eve said, you've always championed the survivors in your work without being asked. And back in 2015 and 16, when Rainbow was losing our federal funding, you stepped up and asked the city to step up, and you passed a motion that restored that funding through city general funds. So thank you for that and for all the work that you do to highlight this issue. Rainbow also co-leads the Domestic Violence Homeless Services Coalition along with Downtown Women's Center, because we've recognized for a long time that domestic violence and homelessness is a huge intersection, and we have worked in silos for too long. So since inception of that coalition, we've done a lot of work to break down those silos and to try and work together to address homelessness amongst survivors of domestic violence, sexual assault, and human trafficking. And we also incorporate survivors in all the work that we do, because they are really the center of our work. So when we talk about domestic violence and homelessness, survivors are 30% of the adult homeless population. The city of LA state that domestic violence is part of their experience. So one of the largest subpopulations, and yet it doesn't get a lot of attention. So thank you for putting together this forum today.
Thank you, Elizabeth. And yes, you know, it's not one of the largest, not only is it one of the largest populations, but it's unfortunately one of the new populations that are the highest rates of homelessness. And those are single women, in particular domestic violence victims. And of course, if we overlay language barriers or cultural barriers, they're even getting even less services. And you know, and domestic violence issues, growing up in a lower income neighborhood and in a minority neighborhood, I grew up with domestic violence all around me. So this is why I am committed and dedicated to issues of domestic violence. Before I even ran for office, I was a board member at the Center for Pacific Asian Families, which is one of the county domestic violence approved shelters. And that's why in 2015-16, I made it a point not to make sure it was cut. But I thank you for all of your work, because you guys are really doing the heavy lifting. And with that said, you know, I want to go straight to questions. You know, I think Kandee said this, that it was already a pandemic when it comes to domestic violence, the rates and everything else. But now that we do have the coronavirus pandemic, it is making it even worse than before. But actually, I want to hear, maybe Faye could kick it off. As someone who's spent decades fighting for equity, can you talk about kind of the trends, what you're seeing for women, especially in COVID-19, and what makes the gender gaps even greater than ever before?
I can. Thank you so much. The gender gaps have always been there. But what we find as we began to serve the population, the women that we serve on a regular basis, they earn less, they save less, they hold insecure jobs. In many cases, they're the primary provider for their family. And when you combine all of that together, and then you add to it domestic violence, you add to it sexual assault, and yes, we have a very large sexual assault program, but we have other things that have caused us to really pause and say, have we done enough? And one of those areas is in the area of homelessness. And it has struck us very, very painfully about 1.5 years ago, Councilman. And I don't know if it was divine intervention for this day, this time, but we started working on that issue with Councilman Mitchell Farrell. And along with Councilman Mitchell Farrell, Mayor Eric Garcetti, we have opened a center for shelter housing for homeless women in Hollywood for 125 persons. We're also starting construction on permanent housing for homeless women with 66 apartments. And why are we doing that? We're doing that because domestic violence is at an all-time high. We partnered with Genesee, Kandee, and we've been providing extraordinary services with them. Nationally speaking, women make 80 cents on the dollar. Our sexual assault abuses are so high that we've been asked to participate on 3 college campuses in this area, and the last one notably USC. The COVID problem has created something else for us. It has opened our eyes with regard to how do we serve, not what is needed, but it's the how. A nonprofit has a very difficult position because we operate with monies in, services out. The monies that come in have specific requirements on the expenditure for those dollars on services. All too often, the dollars that come in, some cases don't nestle with the need for the services. What we have found post-COVID-19, and it's largely through the tremendous donor of BET Network and United Way, because of the disproportionate number of African Americans and Hispanic Americans that have been hit by this problem, we've been given dollars to structure a new response system for individuals who are adversely impacted by COVID-19 in the South Central Los Angeles community. It's a test case, and my guess is it's going to last. We call it the Ujima Project. And it's the Ujima Project because it encourages the safe, supportive services of every member in the community. And what does it provide? Provides the basic tenets of being able to live. It's financial assistance. How many people you know have been thrown out on the street because they don't have financial assistance to pay their rents? We provide financial assistance through this program. We provide transportation assistance through this program. We provide meals through this program. Over 1,000 meals a week are going out, not only to members of the community, but we pinpointed certain agencies like domestic violence agencies, Genesee Foundation. We're delivering to them. We're delivering to senior citizen programs that are not getting enough food. Additionally, we've opened a case management system. With the support of USC, it takes a village to do all of this, you know. With the support of USC, we have interns and we have developed a case management system so that we not only can deal with the emerging needs, but more importantly, the needs that a lot of times don't even get talked about. I'm talking mental health needs, medical needs. We have a telehealth program within our Ujima project. And I am so pleased that we were given this opportunity because were it not, I would have thought the only thing that needed to be provided was additional childcare. And we got childcare going throughout the entire greater Los Angeles area. That still is a priority. But what I've learned since this is that we don't provide enough, and the services we provide are not always at the right time. What do I mean? We got a lot of essential workers, low-income workers that work at night. And where do they leave their kids? With a senior citizen, with a parent, with an older sibling, or by themselves? Well, that has struck us as an intentioned way of elevating domestic violence, elevating sexual assault, elevating homelessness, and the whole 9 yards. And if we block that entry into all of that, we might be able to keep some families intact. So childcare has got to be expanded because I'm looking at this as one of the larger requests that are coming to us by the parents in the community. Yes, they need food. Yes, they need their rent paid. Yes, they need transportation, but they need someone to take care of their babies. So when they get a job again, and I say when, because most of them are now unemployed, laid off, not collecting enough unemployment insurance to keep everything going. So when they get a job again, they'll be able to re-emerge and become the sole provider of their families and move into a safe environment. But more importantly, move into that environment in a way, method, and manner that they didn't know before, because they have help, they have a support system, they have a case management system. They know that they're not crazy when they need mental health counseling. And that is, it's a standard throughout the community. It's a point of shame almost to say, I don't know what to do. Well, let us help you know what to do. And that to me has been the largest umbrella, if you will, that covers all of this COVID-19 process as it relates to women, as it relates to victims, as it relates to families, because many of them do not know what to do. They're scared, they don't know where to turn, and they don't have any money to get there if they did know where to turn. So those are some of the things that we have been faced with, and those are issues that we are responding to. And our goal is to expand it well beyond that. And we're moving into that workforce training for women so we can elevate their position and their status of work as they elevate their earnings in that area. I don't want to take up all the time, and I could. So.
No, but thank you, Faye. I mean, wow, I don't even know where to begin. I mean, you just hit on every single point, and that's great. And that just takes me back. Very unfortunate. A lot of the issues you're talking about now are issues that we've been fighting for over a decade ago. I remember
over a decade.
Office, yeah, trying to get childcare. Wraparound services was the first time when we started instituting it. One-stop centers, and 10, 15 years ago, and
Right.
It's moving forward. And even though we're in this crisis of this pandemic, it is, I believe, and maybe you guys could comment on it too as well, that we're actually delving in deep to the systemic problems, and there's an opportunity for real systemic change.
Yeah.
And it's an exciting time. So, yeah, and so Kandee, you know, Faye mentioned one of the groups that you are in collaboration with, but from your lens, your perspective, what are you seeing in terms of intimate partner and family abuse that was not there before? And also, if you could comment on what's going on about young women in light of COVID-19 pandemic, because I know you work with that population as well.
Absolutely, thank you. So what's happening now has been what's been happening all along. The lens has just been lifted. The covers have been pulled back, and we're able to see. And then also because of COVID and social media, we're seeing everything in a real live, real time status. So one of the things that is most concerning, Ms. Washington, you really laid some things out, and thank you, because the first thing that I want to talk about is the unrestricted funding that nonprofit organizations need. We need to be able to support survivors and those who have been victimized based on their needs at that time. Sometimes we think, oh, we need to help this person to get housed, but what they really need is food. What they really need may be daycare. What they really may need is just mental health services or someone to listen to them. And so when we receive funding that says, you've got to do this program, but that's not the needs of the survivor or those who are being victimized, it ties our hands. And we're not able to service those who need the support in the best way. So to give you an idea, I am working with a family. We do work with youth and young adults, and we do mentoring. And so in our mentoring program, we are talking to the young people all the time, even in COVID-19, either via Zoom or telephone or text messaging with the support of their parents. And there's a young lady that I work with, her and her mother. And the young lady was sitting at home by herself because her mother does not receive that much money, but she has to go to work. And her house is not in the best condition. The landlord is not taking care of the home. And the young lady sitting outside talking to some friends, they all leave except for one guy. He wants to use her cell phone, and then he needs a piece of paper. And when she goes in the house to get the paper, this young man rapes her. And Ms. Washington, I did refer them to your agency. And so the problem is we're seeing a lot of youth and young adults that are being sexually assaulted in numbers that are out of control. It was already bad, but the number of young people that call me on a weekly basis or their parents to say that they've been sexually assaulted is phenomenal. And then mental health services are so critical, especially mental health services being provided by people who look like you, who understand you, that have a cultural relevancy to you and your community is important. And we don't have enough services. So they're calling us, and they're not calling us between 8 and 5. They're calling us at 9, 10, 11 o'clock at night, sometimes 7 in the morning. And we take those calls. Not only do Positive Results Center, but all of the women that are part of the Black Women Leaders of Los Angeles, we are actively working 24 hours a day. And because of COVID-19, our funds have been diminished significantly, but that does not mean that we don't still do the work. So the most important things are mental health. We need mental health services in a major, major way. And nonprofit organizations, including Positive Results Center and all the other organizations, should have funding for mental health services so that we can better service our clients. Also, I think we need to change some of the language. We're talking about victims, but I want to change it to they are being victimized, because it is not them. It is the person who is doing the violence that we really need to address. And we're not doing as much as we can or should with those who do violence. And we're also not putting in, we're not giving the best service. We're finding that a lot of youth and young adults are being mandated to get restraining orders, and then they're being victimized because they're still with their abuser. And that is also for women. Very often, the violence is a cause of something else, whether it is the violence that they've experienced as a child or a young adult, or due to sexual assault, other domestic violence, or maybe they have a lack of employment, lost money. But what happens is that the person who is being abused, they are mandated to get a restraining order, especially if there's children involved, by a social worker. And they want the violence to stop. They don't want the relationship to stop. So we've got to do more education and to help people to become aware of what are the signs of violence and how to prevent violence, and also how to have healthy relationships. We need to work with youth and young adults more so that they understand that they're not the problem, because that's the way they look at it. And then finally, I want to talk about that we are living in trauma all the time. We are not just traumatized by the domestic violence, by the sexual assault, by the homelessness. People talk about PTSD, which indicates post. Let's talk about CTSD, which is the continued traumatic stress disorder that we live in 24/7. The fact that COVID is here and we can't see our loved ones and people are dying around us, or if we touch them, we're afraid that we're going to get something. And then our young people are sitting at home trying to teach themselves. They don't have benefit of going to school and being engaged with other people. So as Ms. Washington said, we've got kids that are being left with predators who are sexually assaulting them or physically abusing them. And we are not able to see that because we're at home. We don't have benefit of going to school or park or library where someone may be able to assist and support them. So there's many, many problems, and we could talk forever.
Yeah, we sure can, and we will. And thank you for that, Kandee. I want to turn it over to Elizabeth now. Elizabeth, obviously, you could talk about general trends as well, but if you could focus on, because I know your organization has long provided transitional and supportive housing. So if you could maybe talk about some of the trends and what you're seeing about women who are becoming homeless in need of services since the pandemic began, because, you know, it's either they stay home with the abuser or become homeless, right? So if you could kind of talk about that.
Sure, yeah. Rainbow Services provides shelter and support services to anyone impacted by domestic violence, empowering them to move beyond trauma and towards safety and stability. What we've seen since the beginning of the pandemic is our hotline calls have tripled, and a majority of those calls are specific requests for shelter and for legal services. So we've seen a huge increase in the number of victims or survivors who are requesting legal assistance to file restraining orders. And we've done a lot of work with the city and the county to make sure that law enforcement and judges are aware that the emergency protective order can be expanded beyond the 7 days, all the way up to 30 days to help support the victim's case in gathering information for the court. So we were one of the first partners for Project Safe Haven that initially started out of the Mayor's Fund and now has moved to HCID. The City Council, as you know, Councilmember Ryu, recently approved $5 million to continue Project Safe Haven. And through that program, we've been able to support an additional 50 households who we weren't able to take into shelter. So for our emergency shelter, people can stay up to 90 days. We can house 8 households at a time. We've had to reduce our capacity there to try and prevent people from sharing bathrooms and to keep people distant from one another. So we serve maybe 45 families throughout the year in our emergency shelter. We've served over 50 families through Project Safe Haven, and we're really grateful that that project will continue. But since the pandemic began, we kind of took away all of the timeline constraints that we used to place on survivors, and we would, only ask people to leave if they absolutely had a safe and permanent place to leave to. So we haven't served as many people through maybe our shelter system. We've served a lot more people through the hotel program. But the biggest thing there is, where are people going to go if they've lost their job, if they don't have income? We can help them for a time through our rental support program, the DV Housing First program, but eventually they're going to need to make it on their own. So we're really concerned about the economic outcome of all of this, because we're still in the midst of it, right? So I don't worry as much today because we do have a lot of funding coming through the CARES Act and feeling pretty supported. But what's going to happen a year from now when even more people are in need? And if we're seeing 3 times the amount of hotline calls today, what's that going to be like, 6 more months from now?
Wow. Thank you for that, Elizabeth. Yeah, even when the pandemic is over, it's going to be a post-COVID world. And I think Faye mentioned it. It's going to be a slow transition back. There's a good question that came in, and I want to remind anyone on this discussion, on the webinar, that they could ask their questions on the Q&A. And this comes from Karina, and this is for any of the providers. Are you providing with any women's health clinic to help assist them with emergency contraception and reproductive life planning to help with these issues? Do you partner with any organizations, women's clinics, or do you give contraception and these services yourself? Anyone can answer. And I think also Karina would love to help as well, but I'll get to that question later.
So we definitely partner with different agencies and refer people out. I'd like to also refer one of the partner organizations in the Black Women Leaders, and that would be Black Women for Wellness. They're a dynamic organization in South Los Angeles that someone should reach out and find out what programs and services they provide.
Elizabeth or Faye, did you want to comment on that?
Sure, yeah. We do partner with our local health clinics, and definitely whenever there's a survivor who's in need of contraception, we help them to figure out what's the best options for them and then support them with that, whatever it is they choose.
And likewise with the YWCA, we partner with various health organizations, hospitals, if you will, primarily those hospitals that we are associated with when we utilize them for testing for our victims of sexual assault. We also partner with them and other aspects as well. So it's a partnership.
Great, questions are coming in. And you know what? I forgot to ask Eve from the official side, who oversees the entire LA County. Can you comment on the trends that you are seeing overall throughout the county? And if you could elaborate, if there has been an increase in women becoming homeless. We kind of know that answer already, but I wanted you to, from the county perspective.
Thank you so much. Well, I want to echo what everyone has already said about the needs with regards to mental health and to work with child services. So I want to say that we are really working hard. I actually have a call this afternoon to connect to to the Department of Mental Health, and we've made connections between the DV Council, so the DV work, and mental health throughout COVID, really, that haven't been made before. So we're all working on a lot of these issues together. As far as the trends go, a lot of this echoes what Elizabeth had brought up. The county runs a domestic violence hotline, which works as a pass-through. So people call, they enter a zip code, and then they're attached to a DV agency. And just so your listeners know, it's available in multiple languages, so people can call and get that information and that connection. Those calls gone up substantially, and I wrote down some of the numbers. So we were starting in January, February, pre-COVID, at about 500 calls. In May, we had over 1,500, and we've now sort of leveled out at about 1,000. So we're running at about double our rate. And since those calls are transferred, those numbers would also be reflected in agencies. We also have, as COVID started, we put together a group of people active in the city and the county, law enforcement, providers, actually mental health, and a number of departments to speak on a regular basis, DCFS, the sheriffs, LAPD, to make sure that we were on top of what was going on and we could address anything that was emergent. The law enforcement numbers did not skyrocket. They went up, but we were fortunate compared to other jurisdictions to the degree that you can take those law enforcement numbers, because a lot of people don't want to bring law enforcement into domestic violence, which is why the agencies represented here and throughout the county are so important, because really we have to have numerous pathways for people to seek services. So people who don't want to call law enforcement for many different reasons, all valid, can reach out to these organizations to get the assistance that they need. So I think really in LA, what we've seen is this increase in connection to services through hotlines. We did not have increase in domestic violence homicides here, thank God. And so we were very, that's very different than some other jurisdictions across the country. Importantly, one of the really positive, if you can find positive or moments of positivity in COVID, is I think the field has really come together. We have an amazing, as you can see from the people on this call, and countless others who work in Los Angeles in domestic violence, and we have all come together in an amazingly collaborative way. As Elizabeth said, we're able now, we face a shortage of housing for domestic violence survivors from as long as anyone who's done this work can remember, and Faye is nodding because she knows that to be true. We were so fortunate that the city, both the Mayor's Fund and then City Council, have extended Project Safe Haven, because really for the first time in the longest period of history that I've worked in TV, and I've worked in TV quite a long time, we were able to offer additional housing to people, safe housing to survivors that we haven't had before. So through that program and through the hard work of the agency supporting that program, we were able to provide, they've housed well over 1,000 people. But one of the speakers, I think it was Faye, had said that this takes a village. And I think it's really important to know the collaborations that have been made. Kandee and I work together on a number of projects. We're working on a project now about how domestic violence community can better support the Black community. I work with Elizabeth. I think I talk to Elizabeth almost every day. And we really have brought, one of the things the Domestic Violence Council has really worked hard to do is to make sure that people have resources. We've worked on everything from making sure diapers are going out to service providers, to arranging with Costco that DV service providers could go over the limitations that they had put originally when you couldn't get toilet paper, you couldn't get anything, and there were limitations put on, and the DV Council worked with them to have that lifted for all the DV shelters throughout the county. So the trends are, it's hard, you know, I'm in DPH, and we look at this as a public health problem, which is based on data. So it's really hard at this moment. We don't really have the data. Okay, we're starting to get the data about exactly what's happened, but I want to echo what the other people have said and what you said originally, which is what we've seen and what people have reported is mostly not only this hotline increase, but the intensity and severity of domestic violence that's gone on. It's not necessarily that people who were non-abusive become abusive. It's that the people who are abusive, and they may not have been physically abusive previously, but now they become physically abusive. And those who are abusive, as this increased loss of power and control occurs, become severe, much more abusive. So people report much more severe incidents. So those are basically the trends that have been going on.
That's great. So many great questions are coming in. Eve, I want to ask you this. I think this is, there's a question about, are women in hotels, I think she's talking about Project Room Key. Are women in hotels receiving any type of support other than housing, like support group focused on DV awareness, trauma recovery, healthy relationships, etc.? And Project Room Key, for those who don't know, is a project that we're targeting for those homeless, unhoused neighbors, and we're trying to bring them into, we're renting out motels and hotels as well as rec facilities, and we're placing them on a temporary basis. So that's what Project Room Key is, and I think that's what she's asking about. Eve?
Well, I want to go back to Project Safe Haven, because Project Safe Haven, and Elizabeth can elaborate on this as well, does provide complete wraparound services, because people, as they enter the program, are connected to an agency. They have provided case management services, transportation services. They have food cards. So yes, they're complete wraparound services in that program. Project Room Key is slightly different because it is not only for older survivors, but people who have, I can't remember the word, you know, they're more at risk for getting COVID. So it's a slightly different
Underlying health
population.
issues.
Thank you so much.
You're welcome.
And so that's a slightly different program organized through LASA, and I believe they connect people to services. Some of those sites are actually run by agencies that can provide additional services, but Project Safe Haven is really the model that has been incredibly supportive of survivors.
Yeah,
Elizabeth, can you comment on Project Safe Haven? Can you also maybe comment about, in Project Room Key, if someone gets identified as a DV survivor, then how do they convert over?
Right. So Project Room Key, like Eve said, is run by LASA and specifically for single adults, mainly the elderly, but then also any single adult who has underlying health issues that may put them at risk for COVID. Project Safe Haven, we did, you know, when we were first invited to look at that program, we had to look at our capacity to provide all of the services that we offer through Rainbow. So case management, legal services, counseling. We're doing everything, you know, either by the phone, or we're doing our support groups on Zoom now. So everything that a survivor may need is offered to them, including housing advocacy to get them out of the hotel as quickly as is possible with the funding that we have to identify permanent safe housing. So Project Room Key, LASA does have a DV manager who looked at the data with Project Room Key, because there are a number of people who identify as survivors. And so if they identify as survivors, they can be connected to DV specific services in the area that they're at.
Thank you for that. Okay, wow, a lot of great questions, but this is an important question that I want to have everybody able to answer, and I want to give everybody an opportunity. One is, how can anyone get services? Whether it's this call or if they know somebody who might need these services, where can they go to get services, particularly your organization? And obviously Eve could talk about all the other services. And secondarily, there's a lot of folks who have expressed interest on how can they help. can they get involved? So if they want to volunteer for your organization or any other avenue, how can they help? So how can they get help and how can they help? And actually added to that, Jackie Fila, who is our president of the Commission on the Status of Women, asked a very important question. So when you talk about services that you offer, there's a lot of young people logged on to this webinar listening who are home more during this time and may be exposed to increased violence. Can panelists walk them through what they should do, who they should contact, and what the process looks like? In other words, can you please demystify what services are available and what they can expect? So if you could talk about, if you have services specifically for younger women, what that would be, and to this question, and services overall. So I will start with Kandee, go ahead.
Thank you. So first off, I want to say to young people and anyone that's on this call, if you are experiencing violence or abuse, it is not your fault. Know that. Very often the person who is victimizing you, abusing you, will try and make you feel like it is your fault that you've done something, but you did not do anything. I don't care what you've done. I don't care what has happened. It is not your fault. And violence looks like so many different things, and it's different for everyone. And it could be verbal abuse. It could be emotional abuse, making you feel like you're a problem or that you're causing a problem. It could be the physical, sexual. It could also be spiritual, using the Bible against you. It could also be financial, not allowing you to get medicine or have money. It might be locking you in the house and not letting you have access to your friends or your network. So understand that it looks so many different ways. And what our agency, Positive Results Center, does is we really focus on creating the awareness to prevent and end violence and abuse. We engage girls and boys, men and women. We also address the LGBTQIAA community so that we can support you, and we have people on, members of our team that identify that way as well. So you can contact us at prc123.org, which is our website. You can email us at info@prc123.org. What we do is we do workshops to help you to really identify what's going on, and we can talk to you, we can text you, we can email you about helping you to really understand, are you in an abusive relationship and what can you do? There's some things that you can do. First off, be very clear in communicating what is going on. Try and use your words. And if you can't use your words, make a song, write it down, make a poem or something, and give it to someone who is going to listen to you, who is going to believe you. And all the adults who are on this call, when a young person tells you something is happening, believe them. Believe them 100% of the time. Don't try and guess, is this really happening, or second guess what they're telling you. You should also be very clear in communicating what's going on and be consistent reaching out. So if you tell one person and they don't believe you, try someone else. And just continue to let people know what's going on until you reach them. Contact any one of us. Each one of the agencies that are on this call, are on this program, work with youth and young adults. And they can also refer you out. I want to also refer you to one of my community partners, and that is Teen Line. Teen Line is an excellent resource. You can text them, and they're open from 6 p.m. to 10 p.m. I really like them because they are run by teens. And so they will be able to talk to you in the same language and help you to really get the resources that you need. But again, under no circumstances should you feel like this is your fault. Comfortable telling a parent, contact any one of our agencies or a trusted adult. And sometimes I know it's hard to find a trusted adult. Participate in some of the workshops that we have. So we have Girl Talk, Real Talk every other week. We also have healthy relationship workshops, and that will help you to better understand what violence looks like. If you are being hurt or hit, It is not your fault. Let someone know, because you don't deserve that. And it's very difficult to say exactly what you should do because everyone's situation is different. And I don't want to lead you one way and that does not work for you. But the most important thing is, again, it is not your fault. Continue to talk. Until we bring both boys and men into the conversation, we will not prevent and end violence and abuse. So we have to have programs for boys and men, and also for those who abuse, and find out why they are abusing.
Thank you. And I think that applies not just to young women, but for persons of any age, because obviously it becomes a repetitive habit. So I'm going to let Faye talk about all of her services that they have, but I also want to let all the panelists know, and all the people on the webinar, I'm going to have my staff put in all the contact information in the chat. So we could have that for you. And we're going to email everyone's contact information on this panel to everyone who gave us your email addresses. So if you could give us your email if you didn't, and also it's going to be on my website. So if you did not get someone's contact information, we will make sure you have access to every organization on this webinar, as well as additional sources. But Faye?
Thank you, Councilman. I want to start first by saying I'm so pleased to be able to let my voice be heard today. And we talked about a lot, but I want all to know that the YWCA of Greater Los Angeles is within 8 distinct communities around Los Angeles. That means we have 8 community centers, and we serve cradle to grave. When I say cradle, we start childcare at age 0, and we go all the way up to senior citizen programs and everything in between. You can reach us through our website, which is www.ywcagla.org, or you can call us at 213-365-2991. You can follow us on facebook.com/YWCA-GLA. And if I get someone that calls and you state that you want to be involved, that just pleases my heart so much, because one of our primary goals within our next couple of years is to align ourselves with more civic engagement, more volunteering, and most importantly, the area that I think real change occurs is through advocacy. And we advocate best when we advocate for your interests. So I encourage everyone on this town hall to let your voice be heard, demand meaningful reforms, and we will walk it through. I can't tell you how many we've been successful at. And most importantly, what I want everybody to remember, vote November 3rd, vote. It all depends on you. Thank you.
Thank you, Faye. And I'm going to let Elizabeth go now, but at the same time, there is a question that says, do you have to be a citizen to get help? Will people have to provide documentation? I want to tell you, no, you do not. We will get you services. I'll let the providers speak for themselves, but you could contact my office and we will make sure you get services to that anonymous attendee. But Elizabeth, go ahead.
Sure. So people can reach Rainbow Services whether they need help or they want to help out at www.rainbowservicesdv, as in domestic violence.org. So that's rainbowservicesdv.org. If people are in need of help, they can call our 24-hour hotline, and all of our staff speak English and Spanish. So we are the default Spanish-speaking hotline for the County DA's hotline, and that is 310-547-9343. So whether people need help or want to help out, they can either look on our website or give us a call. And I forget what else I wanted to say. Such a great job. And we don't ask questions about citizenship. So we serve a large number of immigrants at Rainbow.
Thank you.
And
Eve, go ahead. It's your turn now.
thanks. I just wanted to add, there was a question about helping people. I want to stress also that DV hotlines are available to friends and family and colleagues and neighbors. A lot of times what prevents people from actually reaching out to survivors is people are hesitant or frightened of opening up that conversation. They don't know what to say. They don't know where it's going to go. And the reality is it's far less complicated than that. You could hear from what Kandee was saying, things like it's not your fault. We believe you. Very, very simple kinds of supports are often incredibly helpful and can be the start of sort of life-changing work that someone does. So it's far less complex, but if you're uncomfortable, you too can call a DV hotline and talk to somebody about how you might talk to someone. And as far as offering help, I'm going to say this because everybody's much more polite from their agencies. One of the things that, of course, your work and your willingness to volunteer is wonderful. If you want to participate in the Domestic Violence Council, we welcome you. I would refer you also to our website, which frankly, the easiest way to get to is to Google LA County DV Council. The website is publichealth.lacounty.gov/DV Council. So better to Google it. And the hotline number is 800-978-3600. But so there are resources there, and I forgot I just did sort of what Elizabeth did, what I was going to say. But there are a ton of resources available. Our website lists not only things like how do you get free legal services, how do you, what food programs are available, what are the shelter hotline numbers, all of those things. It's really a matter of reaching out. Many services, like Kandee mentioned, you can reach them by chat, you can reach them by text. So it's really open to everyone. So much of breaking the chain of violence or the cycle of violence is getting someone to actually to reach out, whether or not they're ready to enter support group or anything like that. There's no pressure to do something you don't want to do. You don't have to leave your relationship. You don't have to leave your home. You can stay home, but you can still get support to help you make decisions that work for you. And so a lot of people don't reach out during COVID, particularly because they're concerned, are these agencies safe? So all the shelters throughout the county have been practicing the appropriate standards. Many, almost all service providers have online services available, so you can do that from a place that's comfortable for you. So everybody is there to help you. Don't feel like you have to have made a decision about exactly what you want to do before you ask someone for help. It's fine just to have the conversation.
Thank you, Eve. And on that, you answered it, but this is an anonymous student question again. Do you need to call the police to get help for domestic violence? Many people don't want to talk to the police. Can you again state that you do not have to, but Eve, if you could mention that, and maybe someone else could also chime in as well.
Right, you do not have to call the police. If you are in imminent danger of harm and it works for you and you can call the police, you can call the police. If you don't want to call the police, you can call a hotline. You can if possible, get to a neighbor or a friend or call a hotline. They will help. They can help you get transportation if you need to leave a situation. But again, what's important is to know that it's all about you. If you need help, the help will be given to you in the way that you need. It doesn't matter what your immigration status is. It doesn't matter how old you are. It doesn't matter, what race you are. None of those things matter. You have a phenomenal community here in Los Angeles, all of whom will help you and bring the services to you based on what your need is today. And if your need changes to something tomorrow, that's okay too. don't feel like you have to have figured out how to figure this out. Just know that there are people there who will help you have that conversation and help you make those decisions.
Thank you, Eve. And just please talk to someone. And Kandee, I'm going to let you speak on it, but actually this goes right into it. From a great question from Shanika. Shanika, how would you recommend? What tips would you give on having effective dialogue about topics of domestic violence, abuse, or related behaviors to friends, family, especially when treated as a taboo topic, especially for minority communities, right? You have to behave, you do not want to speak out, and everything else. So Kandee, it's the, if you want to actually touch on that as well.
Thank you so much. What I first want to talk about is for friends and family, please do not shame or blame the person who is being victimized, because you are then further victimizing them and making them not want to share their truth. Understand that it is their truth. It is not their story. It is their truth and their reality. The most important things with sharing your truth, as Eve said, is it all begins with communication. So when someone comes to you and shares with you, or if you're even concerned that this is happening to a loved one, let them know by starting off with, listen, I love you and I'm really concerned that maybe your health or your safety is in danger. How can I help? Please don't shame them or start the conversation off with, what's wrong with you? Why are you in that abusive relationship? Why are you letting someone do something to you? First off, people who are being abused, they're not letting someone do something to them. They are in an abusive relationship, and it is all about power and control. And so if you want to help someone, if you were concerned, start off with, what do they need and how can I support you? Because that is most important. As I said earlier, we might think that that person needs one thing, but they really need something else. It's important that we are honest with our feelings and that the person who is being victimized understand that people do love you and want to support and help you. It is not your fault, whatever is going on. And as Eve said, you don't have to leave or be on someone else's clock. So you leave when you are ready to leave. If you feel like you are in imminent danger or your children are imminent danger, then find a safe place. I always say create a plan and share with only 1 or 2 people. Don't share with everyone, because when you are about to leave, sometimes it is the most dangerous time. Don't go to your parents' house. Find a safe place. A shelter is a great place, and a lot of people don't want to go to a shelter because they don't want to give up their freedom. But you no longer have freedom when you are in an abusive relationship. It is about power and control. If you're concerned about your children, be concerned about their health, because we're seeing right now, we're seeing on the news every single day and sometimes her children are being killed by the abuser. If your abuser is telling you that they're going to kill you, trust that they're going to kill you. It may not happen today, it may not happen next week, but that person's intention is not good, and it is not based on love. And so that's an important component to understand, that abusive relationships, that person does not love you the way that you need to be loved or you should be loved. Because if they did, they would not hurt you, they would not harm you. There is an underlying problem, and it has nothing to do with you.
Thank you, Kandee. I think the bottom line is, for the anonymous student, whether it's for yourself or your friend, please talk to someone. And if you did speak to someone and they did not understand you, there are multiple other avenues as expressed today. This question, well, I want to let Faye and or Elizabeth answer this one, because actually this is a real case and that person needs help. And I really want to first thank Alicia for your courage in sharing your experience and reaching out for help. And her question is, I have experienced all that is being discussed. I've endured 2 years of abuse for the sake of my kids, and I have no family around and no money. As a mother, I was fearful that the experience of going to a shelter would be traumatizing to my kids. I chose to continue to stay to shield them from that. I have since gone through the court system to alleviate this. However, the abuser is using the court system against me. I have not received any financial support, and CalWorks isn't nearly enough to keep a roof over myself or my kids. This is not so much a question, just a one issue that survivors of DVs face, and I have yet to find a solution. Faye or Elizabeth, you guys could both chime in. Faye, go ahead.
I don't know. Faye, do you want to go first?
Go ahead, go ahead.
Go ahead, Elizabeth.
Yeah, I would just say, you know, the people that we serve in our shelters is only about 25% of the overall population that we serve at Rainbow. By far, the majority of survivors we're serving live in the local and surrounding communities. And we do have a community housing program that assists people with getting to a permanent housing situation, supporting them in their rents for a number of months, up to 2 years, depending on the situation. And I'm not making any promises, I have to say that, or my staff will kill me. But we do have different types of supports for people who aren't ready or maybe just don't even need shelter. If we can figure out how to get people into safe permanent housing and bypass the shelter system, it's actually a lot more cost effective. And then it leaves those shelter rooms open for people who are actually fleeing very dangerous situations, as was intended. And that's why the system was built. But what we've seen over the past, I would say 7-8 years, is a lot more people whose last incidence of abuse was many months ago, and now they find themselves homeless. So in traditional DV shelter organizations, we would say, oh, they don't qualify because they're more homeless. But really, if domestic violence is what led to their homelessness, then we want to be able to assist them. But there are a lot of different types of supports without going to shelter, and that person can reach out to Rainbow's hotline to learn more. And depending on where they're located within the city or county of Los Angeles, we would connect them with an organization that's similar to be able to support them, even if it's just supporting them through their legal process.
Faye? Oh, you're on mute. Unmute. Oh.
Okay. Am I unmuted now? Okay.
Yes.
We have recently, as I stated earlier, started a program that really, I think, speaks to this person's needs. It's not for long-term housing, but it is for temporary housing, and it's under our Ujima project, and we do provide the rent funds for that. I would encourage that individual to contact us at 213-365-2991 and ask for Sunya Johnson, and we will be able to put you in touch with our case management system that can provide temporary housing and shelter for you. And then beyond that, we work out a plan that gets you to where you need to be. But long story short, during this COVID-19 process, we do have funds to provide those much needed. And otherwise, we wouldn't have the funds if it were not due to COVID-19, but we can provide that level of support today. So give us a call.
Thank you, Faye, for that. And yes, I'm not sure if Alicia is already working with a provider, but as you know, you could call the organizations here, like Faye has a program, but there is a group of LA County approved domestic violence residential system. Yes, they are usually full, but this is why I made sure back in 2016 that there was no cuts. If anything, we need to increase services for DV services, housing, and everything else. But please contact my office. Please contact Faye, Elizabeth, also Eve. We'll all work with you to try to figure out how we can make sure we could get you to a much better place. We can't promise anything, but there are services out there, and it's unfortunate. Your situation we've seen way too often, and this is why we need to increase. And some of these domestic violence housing is private locations where even I, as the council member, don't know the location, and it is purposely done on purpose. Eve, I don't know, do you want to add anything?
Did want to say that LASA, the housing organization, actually has a DV housing coordinator in each spa as well. So if you outreach to the local agency that's handling homelessness, they can connect you to a DV coordinator who can either get you to DV services or help you, assist you in locating, be it emergency housing, some other interim form of housing. So that's another resource that's offered through a government agency.
Yeah, thank you, Eve. And yes, the Aviva Center that I opened up on the Hollywood area is for transitional age youth women, single women, or single women with children. That's for women that are 18 to 26. By the end of the year or first thing next year, we're going to have another 80-unit housing facility for families that is going to open up in the Los Feliz area. So these aren't geared towards domestic violence only. It's for our unhoused populations, but it is a temporary measure till we get you into a more permanent setting. So there's a lot of services out there. There's a question from Melanie Cruz. This is for anyone who wants to answer. Does anyone have a sense of how public charge has hindered survivors or those victimized from accessing housing or mental health services? This might actually, for Elizabeth, might best answer this one.
I was going to pass to Eve. I'm
Eve?
sure I'm not familiar with that as much, or not sure quite what the question.
The public charge. You know how the Trump administration has established a public charge rule where immigrants that are for non-citizens or undocumented, that they can't apply for food stamps, Medicare, social services. Obviously, that has, unfortunately, the Trump administration has been doing way too many of these tactics. So it is really driving the undocumented population even more underground. So have you seen that from survivors and victims less accessing housing or mental health services? I think it goes to the question that the student asked earlier about undocumented, because a lot of people feel that it might hurt them if they actually come and ask for services.
So, you know, without practicing immigration law, I would just say the bottom line is all of these services are available to anyone. No one in this entire field assesses people based on their immigration status. What I think the issue is as the council member mentioned, that the cumulative effect of all of these changes creates a certain level of fear. But there are programs available. For example, in the East LA area, there's East LA Women's Center who has a Promotora program where people go out in the neighborhood and explain to people how they can access services. So really, the bottom line is, although there are strong efforts to sort of place these barriers in front of people, this field in particular has very wide open doorways. So they should be able to help you. We also have a very, very strong nonprofit immigration bar in Los Angeles. I feel like I'm the cheerleader for Los Angeles on this call, but it is really a wonderful community. If you go to the DV Council website, there's a full list of legal service providers, the hours they work, the numbers to reach them. They're all available remotely. You can get some even court assistance remotely, and they can help people negotiate through these public benefits mazes and point them to other places where they can get support services. Like Faye had talked about that earlier, about food and so forth, if they're having trouble going through sort of the services that they used to go through.
Can I also,
sure, go ahead, Kandee.
So if anyone is experiencing domestic violence, homelessness, sexual assault, it's important that you find an agency, but maybe you don't know who you should go to. If you are working with any type of social service agency or nonprofit, please reach out to them, because we partner and collaborate in many different ways, and we can refer you to different people. I again want to bring in and uplift the voices of the Black women leaders of Los Angeles. We have a phenomenal group, And although most don't work with domestic violence, as I said, Black Women Leaders of Los Angeles does do so many things, along with the California Black Women's Health Project. They're really focused on helping women to identify different programs and services that they need. Forgiving for Living, there's so many different. I have to talk about two organizations in particular, and that is Sanctuary of Hope, who works with transitional age youth who are homeless, who are also experiencing domestic violence and sexual assault, and Uplift Forgotten Children, Inc., which is addressing sexual assault, or excuse me, sex trafficking, and just trafficking in general. And very often, both boys and girls who are being trafficked are also experiencing domestic violence, intimate partner violence, and sexual assault. So whoever you're working with, if you're going to a library, a school, if you're talking to even some churches and organizations, they really know how to reach out to our organizations. There was a note put in, Project Peacemakers with Bernita Walker, and also New Start Family Justice Center in Hawthorne. Phenomenal agencies. Please reach out to anyone. Don't let the thought that you don't know who to reach out to prevent you to reaching out to someone.
Thank you, Kandee. And I just want to second that. Again, your undocumented status does not matter. Any type of status, criminal record, no matter who you are, what you do, it does not matter. There will be services for you. Unfortunately, we are seeing so much of this when it comes to voting, when it comes to census count, and even for getting services for DV. Please do not feel scared. Please do not feel hindered. There are services for you. Just make sure you contact somebody. Also, I want to really thank our commission president for the status of women, who always gets me back on track. Very important question. This is more a question to you for me, and I want to ask the panelists here, and Jackie asks, no one knows the needs of these communities of survivors better than these panelists. What is the largest need COVID-19 has created, and how can the city of LA, what can I do to help you guys fill those needs?
Affordable housing. I mean, before and after the pandemic, but and as we're in it, if people don't have places to go beyond the hotel room, they're going to end up in the streets. I mean, with Project Safe Haven, we essentially doubled our shelter capacity in Los Angeles County. What is going to happen when that money goes away? Where are all those survivors going to go? Affordable housing, long-term housing subsidies, because while some of our rental programs can support survivors for 6 months, 12 months, 24 months, we really need to address poverty and the housing crisis if we're going to affect any change.
Kandee, go ahead.
Definitely, I'm going to talk about unrestricted funding to nonprofit organizations. It is critical. And as a smaller boutique agency, understand that we do a lot of work. People think, oh, okay, well, they're a smaller group, so they're probably we see thousands of people every year. And because we are community-based, we are in the community, people reach out to us, as I said, at all hours of the day and night. And so it is critical that we receive funding that will allow us to be the type of resource where we don't have to dig into our pockets, which is what sometimes we do. So we will provide programs and services. We will partner with different agencies, but it is essential that we receive an adequate amount of funding and that it is unrestricted.
Thank you, Kandee. Before I turn it over to someone else, that reminds me, and I think Faye said it earlier, vote, right? There is Proposition 16 on the ballot that must pass. It restores affirmative action. One of the things that it does is it helps us disaggregate data. And because right now, because affirmative action does not exist, we can't disaggregate data for African Americans, Latinos, women. And on top of that, when it comes to contracting, well, like Kandee said, if we want to help women-owned businesses or women-owned contractors or minority organizations, we can't because there is no disaggregation of data. So it is crucial that we pass Prop 16 and restore affirmative action. That is because we were looking at exactly what Kandee was asking for, but we are, as a government, are blinded, so we can't do certain things. So as Faye said, please don't forget to vote this November on Prop 16. Faye, do you want to go ahead?
Yes, I will. Thank you. And I have to echo the words that Kandee used and that I used earlier. Unrestricted funding allows a nonprofit to respond to emerging needs, to long-term needs, to respond to a need that may be here today and gone tomorrow, but it allows us to serve the community. And that's our main goal. I can say with COVID-19, the one pressing need that I see out there and will continue to be out there, if not for the immediate future, but probably on a long term, and that is financial assistance for housing. Folks have lost jobs, they cannot pay the rent, the landlord can't keep them in there, they get kicked out on the street, and they need housing. If not on a long-term basis, on a short-term basis. And that's where the unrestricted funding would come in to a nonprofit so that we can fulfill that need as we search for permanent solutions. There has to be permanent solutions out there, but until that happens, we need those short-term solutions that provide immediate relief and restores that family to a holistic point of view. And the last thing I got to say, and I would be negligent if I didn't say this, we need equity in pay. We need equity in workforce development training. We need to categorize who gets what, when, where, and how, and where are the priority needs. I know that the city provides training in the area of dollars in the area of workforce development. I actually sit on the Workforce Development Board, but I also know that we are not allocating those funds that really get out there and support based on the needs that we have been talking about today. It goes out to the community at large. But I think there has to be some way to structure those dollars. And I'm going to take this issue back to my board and discuss it with them, because until we start providing equity at all levels, we do have a situation of systemic gender bias, or whatever you want to call it. It is inherent in our system unless we step in and make it right. And it's just as simple as that.
Thank you, Faye. Hear you loud and clear. I'm sorry, Eve. And I think that goes to one of the questions that was asked earlier. As we're transforming what we talk about public safety and the Los Angeles Police Department, yes, this is how we can start shifting some of those monies over for these services. So I think one of the other webinar participants asked that question. And I do also want to say one thing about unrestricted funds. For the people on this webinar, what we mean by unrestricted funds is usually when the county, like Eve, when they give grants or contracts to a lot of the organizations that are on this call, it is restricted, meaning it could only be used for a particular thing. And which really hinders the nonprofit organizations, whether it's Rainbow or YWCA or Kandee's group, on what they can do. That's why unrestricted funds is the most flexible amount of funding. And that's why we see like organizations do annual dinners where they raise money. And that's why when you contribute to one of these organizations, that becomes an unrestricted dollar. And that is so crucial, because sometimes when the city or the county grants these organizations a contract, they require a matching portion, which they're supposed to go out there and find somewhere from a magical money tree, right? So that's what they mean by unrestricted funds. And I hear you loud and clear, and I'm working on that. And Eve?
I just wanted to say, I think one of the important roles of government is to stop siloing. Stop siloing domestic violence. Domestic violence impacts every single thing that the government touches. Healthcare, housing, safety, anything that you do, any law that gets passed, there has to be some way to look at that and how that's impacting domestic violence survivors. We have been left out, so now we're in this position of constantly saying, what about the domestic violence survivors? What about the domestic violence survivors? But the reality is these issues and violence as a whole, really in Los Angeles, have to be integrated into everything. That conversation, that lens of how is it impacting survivors? How is it impacting women? How is it impacting youth? We have to have this other way of looking at it so that it becomes part of everything.
Can I say one quick thing?
Sure, go ahead, Kandee.
Thank you. We also have to stop looking at those who have been victimized in a certain lens and thinking they look like this. People who have been victimized, people who have experienced domestic violence, intimate personal violence, sexual abuse, homelessness, looks like everyone. Everyone experiences violence in some form or fashion. And very often you'll look at someone and think that, no, they haven't experienced it. Yes, they have. Children as young as birth, even while they're still in their mother's womb, has experienced violence. And children, young adults, you want to know why boys and men grow up to be angry boys and men? Look at the violence that they have experienced as children. So understand that no matter your race, your creed, your color, your financial background, your sexual orientation has nothing to do with whether you've experienced violence or abuse.
Thank you, Kandee. And, you know, and that's absolutely correct. And there's so much stigma associated and so much categorizing. Like, for example, mental health, you know, trauma, depression, this is all forms of mental health. And this is something that we should be not stigmatizing, but accepting, because we're all susceptible to that. And, you know, and like you said, and as Eve said, it is whole wraparound. Whether it's housing, whether it's our foster care system, childcare, paid parental leave policy, children's savings accounts, this is all interrelated. And that's why I really appreciate this panelist here. This is such a great panel. We try to get through as many questions as we can. But wow, I mean, I think we should have a round two just for this panel again. But well, we need to wrap up. We already went over time. But I do want to mention, Pallavi also asked a question about public charge has led to fear amongst many South Asian survivors who think they are ineligible for help and afraid to seek help. That is absolutely correct. This public charge, what the Trump administration is doing in all avenues, is really hindering the efforts, especially in ethnic minority communities and language barrier communities. That's why it is crucial that we have more language appropriate, ethnic, culturally appropriate organizations, and there are many as part of the whole LA County Coalition who are providing these services, and this is why it's more important that we do stuff in language as well. So I really thank you for that question. But this has been a fantastic conversation, and I want to thank all of the panelists again for being here today. And we will be hosting one more lunchtime event just like this. It'll be on Monday, September 21st. And this time we'll be discussing employment and childcare. And we will have another panel of great speakers, including State Senator Holly Mitchell, who many people don't know this, but she used to be the executive director of Crystal Sayers, is one of the largest foster care and children's organizations. Fabiola Montiel from First 5 LA, Gloria Davis from the Girls Club LA, and Melanie De La Cruz from the UCLA Asian American Studies Center. So you can learn more and register to attend on my website at davidryu.lacity.org/events. And again, everyone's information will be posted on my website, and we will try to email everyone's contact information to everyone who signed up. And please seek, if you have any questions, ask the questions, seek services. If you have a friend who might need or have any kind of questions, please, as Kandee said, encourage them, be supportive of them, and make sure that they are connected to one of the anonymous hotline numbers or specifically to any one of the organizations here. So I just want to end with saying, please continue to be safe and take care of yourselves. You can always reach my office if you have any questions or need any help connecting with any of the resources. You can reach out by emailing me at david.ryu info@lacity.org or by calling 213-473-7004. And thank you all for attending, and I very appreciate the panelists. Thank you all. Thank you.
Thank you. Thank you, David.